Each year, there's an estimated 3 million unplanned pregnancies in the U.S. Birth control may be expensive with or without healthcare insurance, but it is way less expensive than having a baby when you're not ready to. Birth control contraceptives commonly used by women today are the pill, the IUD, and the Implanon. I personally have the Implanon, which was inserted into my left arm in March of 2010. First, I'll discuss the pill, then the IUD or intrauterine device, and last, the Implanon or implant. The birth control pill is the most common used birth control. In a case study of about 7,500 women, 4.8% of those women who were on the pill became pregnant within that first year. In another case study shown, younger women under the age of 21 are twice as higher to become pregnant while on the pill because they are most likely not taking the pill as instructed by their healthcare provider. There are two types of birth control pills that are to be taken, and that's progestin-only pill or the combined method of progestin and estrogen birth control pill. Progestin-only pills are known as mini pills, and they are to be taken at the same time each day. They may cause you to have a lighter or fewer periods, and they may not be recommended for women who have trouble remembering to take them. The combined method of progestin and estrogen birth control pill has been tested to be very effective and reversible. Again, the estrogen and progestin, both of these hormones, help to prevent the egg from being released to prevent an unplanned pregnancy. This pill also needs to be taken once around the same time each day. Now let's say you missed your dosage of the birth control pill. You are to know what to do if you miss taking a pill. A backup form of birth control may be needed for a week or more. Here's a small diagram of what the most common birth control pill looks like today. Next, we have the IUD or intrauterine device, which is one of the most effective reversible birth control methods. In the same case study, only 0.3% of 5,800 women who chose the IUD or Implanon got pregnant within that first year. Studies have also shown that women that are on longer lasting contraceptives were 20 times more effective after 3 years of use than the shorter acting methods of birth control. There are two types of an IUD, a copper IUD and the progestin IUD. The copper IUD can last up to 10 years, and it releases a small amount of copper into the uterus, which makes it harder for any sperm to reach the egg. The progestin IUD releases the progestin hormone. This lasts up to 5 years. Things that you should know about the IUD: it is a small, flexible T-shaped device that is inserted by a trained healthcare provider, and it can be removed from that same trained healthcare provider when you're ready to have kids. Here's a small diagram of what that looks like. This here. Last, we have the Implanon or the implant, which is shown to be the most effective reversible birth control used. Again, only 0.3% of 5,800 women that used the Implanon or the IUD only became pregnant within that first year. Studies show it is 20 times more effective. That is meaning women who use this birth control method are 20 times less likely to get pregnant within the first 3 years of usage compared to the other shorter term birth controls. Things that you should know about that IUD, the Implanon, is that it is a small plastic rod that is placed under the skin in the upper arm by a trained healthcare provider. It lasts for up to 3 years, and you can get it removed before those 3 years whenever you're ready to have kids as well. I personally have the Implanon, which was inserted about 2.5 years ago, and here's my card to show proof. This is what they give every patient who gets this procedure done. Here they have the provider's name who inserted the Implanon and the patient's name down here. On the back, it shows the insert date and the expiration date, which is 3 years after the insert date, as well as which arm that the Implanon is placed. Now, as we all know, many unplanned pregnancies can be prevented with any use of a birth control contraceptive, other than common condoms and abstinence, of course. Symptoms for each of these contraceptives vary based on the woman that uses it. You are able to find out every symptom or some symptoms that have been found and tested by your healthcare provider for each of these contraceptives. Thank you.